We're joined now by Eric Howard. He's an epidemiologist with the OKC County Health Department. As always, thank you for stopping by.
Thanks, Marky.
Especially right now, because a lot of people have questions about this. What is the latest? Crunch those numbers for us about what the flu has done.
We're waiting for new numbers to come out today, but you're correct in your previous numbers. We've had over 45 deaths in Oklahoma State this year so far.
So you don't even know those new numbers
Yeah,
yet?
so we expect it to increase again. Last week was a big increase, over 20 deaths, and so that's almost half the cases this season in 1 week. So hopefully it won't be as high again this week, but we don't know yet. In Oklahoma County, we've only had 3 so far that's been reported, so hopefully that'll be the max that we have this season. A big indicator for flu is hospitalizations as well, because there's many people get the flu, but they may not be sick enough to go to the hospital. We've had high numbers of hospitalizations this season as well, over 300 cases in Oklahoma County alone.
Good. Now, I feel like it's somebody new every day, more deaths, more hospitalizations. You were even telling me your health department is not immune to this flu right now. Why is this year so much worse?
Well, it's a H3N2 strain season, so not to get too technical, but there's many different types of flu, different strains, and so this particular strain is more damaging. It affects people at an increased rate, especially the elderly and the young. And in fact, our cases of hospitalization, almost half of them have been in the 65 and older age group.
And I know most of us, even here in the newsroom, you know, if we don't have the flu, a lot of us are getting paranoid. Oh, I have a headache, my neck is stiff. What are the actual symptoms of the flu?
So yeah, there are a lot of differences between a cold, maybe a cold or a sinus infection and the flu. And for flu, you really want to watch fever. That's a big indicator. Then you're going to have body aches, a sore throat's a big one, cough. And it's going to come on suddenly as well. So one day you're going to feel okay, and the next day it's just going to hit you like a truck. Compared to a cold where you might just feel a little bit worse each day, and it kind of builds, your cough gets worse and worse and worse. But we have seen many cases of combined cases of cold, RSV, and the flu as well. So if you think that you're sick, go see your doctor right away, especially if you're in the very young age, if you have a young child, or if you're elderly, go check in with a physician right away so you can get that taken care of.
I even heard from a lot of older viewers saying they're getting pneumonia after the flu.
That's a common
so it can
comorbidity.
Really just double hit you.
Yeah, if you get the flu, oftentimes you can get pneumonia afterwards, and that is a big concern. And that's why we really encourage everyone to get their flu shot.
Is it too late?
Oh, it's absolutely not too late. We expect the flu season to go on for several more weeks, oftentimes into April. And so that's going to be a big challenge now. We may think that the first wave is over, and so, oh, I don't have to do anything, it's done. My coworker got the flu, I'm not going to get it now. Well, it's not too late for you to get the flu, and definitely not too late for you to get the flu shot.
Even if a person gets the flu, I'm hearing from a lot of people who have the flu, and they're like, hey, you know, I got the flu shot, what's the deal? Even if you get the flu, but you got that flu shot, does it help with symptoms at all?
Absolutely. So a lot of people are concerned about vaccine effectiveness, and so those numbers are calculated by if you've gotten the vaccine and then if you've been protected completely from the flu. We don't really take into account how shortened the flu is or how less severe those symptoms can be. And those are two big indicators or two big factors that the vaccine helps with as well. So just because you may get the flu and you've had the vaccine, you're much likely to have a lessened case, a less severe case of the flu.
What is the biggest mistake you're seeing people make once they get the flu?
Number one, continuing to go to work and acting like, oh, it's no big deal. That's the biggest thing. And so we encourage people, if you are sick and if you do have the flu, stay home if you can. If you can't, you have to cover your cough because that's how it's spread, through droplets. So covering your cough is next. Washing your hands is another good way to stop the spread of those germs. We touch our face all the time, whether we know it or not. It just happens all the time. So washing your hands regularly is a big deal as well.
So I'm diagnosed with the flu. Say, when should I return to work? When can I return to school? Or the kids if they get it?
Great question. So you want to wait 24 hours until after the fever has gone without medication. So if you're giving some acetaminophen or ibuprofen, you can't give that and say, well, they don't have a fever anymore. You have to wait till it's gone naturally. So wait 24 hours after that time, and then they're no longer contagious at that point.
Good to know. Thank you for clarifying that. I also want to ask you about Tamiflu. We're hearing lots of different mixed reports right now. I know multiple people who their doctors have said, do not take Tamiflu, don't give it to your kids, causing hallucinations. What's your take on that drug?
Well, every drug has potential side effects, but I would consult your physician and take their advice.
Have you heard that?
I haven't
What
heard
do
that
you tell
particularly
people?
this season. I tell them that if you're sick, go see your doctor, and if they feel the need to prescribe that, then they will. It's effective with some people and not as for others, especially if you don't get in there the first couple of days. It's really most effective within the first 2 days of symptom onset, and so if you get in there, you've been sick for a week, well, you may not have anything to do. You know, they may not be able to prescribe you anything, and so taking it at that point is not really going to be effective or helpful.
And we do, Lance, do we have that picture up of our flu bar? Okay, we have, I'll just tell you about it then, because we had a photo, but our bosses here were great. They set up a flu bar. It's right when you walk into the front door. It's got hand sanitizer, throat lozenges, face mask, you name it. What should be in everybody's workplace or at-home kit to either, stop it in its tracks or prevent it from happening?
Marky, I did see your flu bar, and I think that's a great idea. I think that's excellent.
Did we get a passing grade?
Yeah, no, you got
Okay.
you got an A+, and so. Hand sanitizer is great. Wiping down with Clorox wipes is an excellent way to prevent that. People that talk on the phone a lot, that's great. Go into your office each day, wipe it down, because you don't know what you had the previous day. Even if you are the only one that uses the office, wipe down your handles and make sure that your cleaning staff knows how to clean things appropriately during this season. As far as really taking care of yourself, you do want to do that at home as well, and take care of your family. So if one person has the flu, pay extra attention in your household, clean those door handles again, make sure that you can kind of isolate them if possible. If you need to put on a surgical mask or even just wear a bandana around the house, that works. It's not a matter of shame or anything. It's a matter of keeping your family healthy.
Right, and I go to the gym a lot, and I'm watching people. I have eyes like a hawk right now, and I'm the last person who's paranoid or a germaphobe, and I am making sure everyone cleans down their machines right now, including myself. A last question to you. I know flu season started in September. When does it end?
So it starts in October, and it really
October.
goes until about the end of April. Sometimes a few cases into May. You can get flu all year round, but really the big season ends at the end of April.
Okay. Any final words on the flu that maybe I didn't cover with you?
No, I think we've covered it, but I really just want to tell the viewers to go get your vaccine if you haven't. Cover your cough and stay home if you're sick.